My name is Beloved Dobera, a 100-level healthcare management/nursing student of JPTS Institute of Science Management and Technology, in collaboration with South American University USA, Global Wealth University Togo, and Pan American College California. I will be representing a brief seminar paper on the theme, the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. I would like to start with the definition of a virus. A virus is a small infectious agent having a simple cellular organization with nucleic acid and protein codes. A virus invades living cells and uses its chemical machinery to keep itself alive and replicate in the host. The presence of hepatitis B surface antigen in serum indicates that the patient has contracted hepatitis B virus infection. The test is used to identify those at risk of spreading the disease. Example: blood donors, pregnant women, intravenous drug abusers, healthcare workers, institutionalized people, transplant donors, and recipients and donors of semen for artificial insemination. The quantitative hepatitis B surface antigen screening assays are normally supported by confirmatory tests, which are used to confirm repeatable reactive, which is positive result. Typically, the confirmatory tests involve neutralization of the hepatitis B surface antigen in the sample by 50% using human anti-hepatitis B surface antibody. Hepatitis B E antigen stands for hepatitis B E antigen. This antigen is a protein from the hepatitis B virus that circulates in infected blood when the virus is actively replicating. The presence of hepatitis B antigen suggests that the person is infectious and is able to spread the virus to other people. Susceptibility of hepatitis B virus infection is general. Only people who have been vaccinated successfully or have developed anti-hepatitis B surface antibodies after hepatitis B virus infection are immune to hepatitis B virus infections. Persons with congenital or acquired immune deficiency, including HIV infection, those with immunosuppression, including those with immunosuppressive drugs, including steroids, and by maintenance of hemodialysis, are more likely to develop persistent infection of hepatitis B virus. Hepatitis B can be spread by unprotected sex, sharing IV drugs needles, living in a household with an infected person, an infected mother to her newborn child at birth. Hepatitis B surface antigen is cleared within 4 to 6 months in self-limited infections that resolve by themselves. It can be detected in the blood during both acute infection, that's common suddenly, and chronic infection. In addition to the signs and symptoms that patient has, additional antibodies can be tested to distinguish between adult and chronic infection. Acute and chronic infection, I mean to say. Your body can produce antibodies to any of these antigens once you are exposed to the virus. These antibodies developed at different stages of the infection. If you receive a vaccination for hepatitis B, you will develop anti-hepatitis B surface antibodies, which will protect you from infections by hepatitis B. The hepatitis B surface antigen protein in the vaccine is manufactured by modified yeast cultures, so it is safe from the transmission of hepatitis. Your blood may be screened for hepatitis B virus for many different reasons. The 3 tests generally include hepatitis B surface antigen, antibody to hepatitis B surface antigen, and antibody to hepatitis B core antigen. These allow the healthcare provider to know whether you could benefit from the vaccination, or if you have if you are active or chronic hepatitis B and need counseling, care, or treatment. Thank you.